My name is Anna Hudson. I'm a registered dietitian at Winona Health. Nutrition is important to everybody, no matter what their age or stage of life. But nutrition and consuming a high-quality diet is even more important during cancer treatment. Today's education is going to talk about ways to increase iron in your diet. Anemia is when the body does not have enough red blood cells. This means that the hemoglobin count, the part of the red blood cell that carries oxygen to your body's cells, is low. When this happens, you may experience symptoms of extreme tiredness or fatigue, dizziness, pale skin, or troubles performing daily tasks such as walking or even talking. Some forms of cancer treatment, such as chemo or radiation, can reduce the hemoglobin or your red blood cell count and cause you to feel these symptoms. Depending on the type and the cause or the severity of the anemia, it can often be treated by consuming a diet rich in iron sources. We can find iron in many of our food choices. There are two different types of iron in our diet. The first type is called heme iron. This is the iron that's found in our meat sources. You can find it in any meat source, including red meat, poultry, pork, fish, and seafood. This type of iron is better absorbed by our body. We can also get iron in our diet from plant sources. This type of iron is called non-heme iron. Non-heme iron isn't absorbed as easily in our body, but it's still a very important part of our diet, so be sure to consume these types of foods as well. We can find iron in dried fruits such as raisins or prunes, and dried apricots as well are going to be very high in iron. We also find iron fortified in many grains and cereals and bread products. A cereal such as Total provides 100% of your daily needs of iron, so it's a real easy way to increase iron in your diet. Other foods such as these kidney beans, black beans, other types of beans and legumes will also be very high in iron. We also find iron in our dark green leafy vegetables. Something such as spinach is going to have an excellent source of iron in your diet. It's important when consuming non-heme iron, or the iron found in our plant products, to also consume a source of vitamin C as well, as vitamin C helps aid the body in absorbing the iron that's found in those plant products. A really easy way to do this is if you're consuming a bowl of Total cereal, have a small glass of orange juice to go along with it. If you're having a bean salad, cut up some bell peppers or tomatoes, which are also very high in vitamin C, and blend it into that bean salad. That will provide you with the vitamin C necessary to absorb that iron. Please keep in mind that these are general tips to increase iron in your diet. Depending on the cause or the type of your anemia and the severity, your doctor may determine that other treatment forms may be necessary to improve your condition. If you have specific questions on your diet and your individual needs, please bring these up with your doctor or your nurse. If you would like to make an individual appointment with a dietitian, please ask your doctor or your nurse for a referral to a dietitian, and it's recommended that you check with your insurance provider prior to making that appointment, as coverage rates often vary. I hope you've enjoyed today's education and have taken some good tips away. Thank you very much for watching.